Marine commander refused help until the nurse showed her unit tattoo. The gurney hit the emergency room doors doing 40 miles an hour in a space designed for 20. Metal screamed against tile. Someone yelled. Blood sprayed in an arc across the white floor like a painter had gone insane with a brush full of crimson. The man strapped to that gurney was built like a freight train, all muscle and rage, and something else, something darker that made the air around him feel electric and wrong. If you think you know what courage looks like, you are about to get your mind absolutely shattered. Hit that subscribe button in the next 5 seconds because this story will rewrite everything you thought you knew about heroes, sacrifice, and the warriors hiding in scrubs right under your nose. Elena Torres was elbow deep in a supply cabinet when the chaos detonated. She had been counting trauma pads for the second time that hour because her supervisor loved making the new nurses do inventory twice per shift, some kind of hazing ritual disguised as protocol. The storm outside was eating San Diego alive. Rain came down in sheets, so thick the parking lot looked like a river. Lightning turned the sky purple every few seconds. The whole hospital felt like it was holding its breath, waiting for something terrible to arrive. It arrived at 11:47 p.m. on a Tuesday that Elena would remember for the rest of her life. The automatic doors exploded inward. Not literally, but it felt that way. 2 paramedics shoved a gurney through with the kind of desperate speed that said someone was dying right now. Not in 5 minutes, not in 2 minutes, but right this second. The man on that gurney was massive. Even bleeding out and strapped down, he looked like he could break the restraints and fight his way through a wall. His uniform was shredded. Dark blood soaked through tactical fabric that was supposed to stop bullets. There was a patch on his shoulder, half torn away, the eagle globe and anchors still visible. Marine. Elena dropped the box of trauma pads. Her hands moved on instinct, grabbing gloves from the dispenser, her feet already carrying her toward the trauma bay before her brain caught up. She had been working at Memorial Grace for 6 weeks. 6 weeks of proving herself. 6 weeks of being the new girl, the one everyone watched to see if she would crack under pressure. She had kept her head down, followed every rule, never made waves. That was about to end. The trauma bay erupted into controlled chaos. Nurses swarmed. Doctors barked orders. Someone cut the Marine's shirt away with scissors that flashed under the overhead lights. His chest was a roadmap of scars, old wounds layered on top of older wounds, the kind of damage that told a story written in pain and survival. But it was the fresh wound that made Elena's stomach drop. Entry point high on his right side, just below the collarbone. No exit wound she could see, which meant the bullet was still in there, maybe fragmenting, maybe tearing through organs with every heartbeat. His eyes snapped open. Not the slow flutter of someone waking up, but the instant violent awareness of someone who had been ambushed too many times to ever really sleep. Those eyes were wild. They did not see the hospital. They saw something else, somewhere else, some nightmare that was more real to him than the sterile white room and the people trying to save his life. He started fighting. Not the confused thrashing of a disoriented patient, but the calculated violence of someone trained to kill. His hand shot out and caught a nurse by the wrist. She yelped. He twisted, and the restraint strap snapped like thread. Security rushed in, 2 big guys who probably thought they had seen everything. They had not seen this. The Marine moved like lightning trapped in human skin. He knocked the first guard back 3 steps with an elbow that would have broken ribs if it had landed clean. The second guard tried to grab his arm and got thrown into a medical cart that went over sideways, instruments clattering across the floor in a silver avalanche. Someone screamed for sedation. A Dr. Elena did not recognize. Older woman with steel gray hair and eyes that had probably seen 1,000 emergencies, shouted orders in a voice that cut through the noise like a blade. Get him under control. Now. More hands reached for the Marine. He bucked against them, his back arching off the table, fresh blood pumping from his wound with every movement. The heart monitor screamed. His vitals were crashing. In 90 seconds, he would be dead. Elena pushed through the crowd. She did not ask permission. She did not wait for someone to tell her it was okay. She stepped right up to the head of that gurney, into the splash zone where his blood was painting the air, and she did something that would either save his life or end her career. She rolled up her right sleeve. There on her forearm, hidden under fabric for 6 weeks, was a tattoo most people in this hospital would never understand. Black ink. Simple lines. a unit insignia that did not officially exist. The Marine's eyes locked onto that tattoo. Everything stopped. The silence lasted exactly 2 seconds. 2 seconds where the entire trauma bay seemed to freeze, where every nurse and doctor and security guard stood suspended in a moment that felt like the world had stopped spinning. The Marine's eyes were locked on Elena's forearm, on the ink that marked her as something she had spent 3 years trying not to be. His breathing slowed, not calmed, but controlled, the deliberate inhale and exhale of someone forcing their body to obey when their mind was screaming to fight. Then the doors burst open again, and everything went sideways. The woman who walked in wore a crisp military uniform, the kind that had been pressed so many times it could probably stand up on its own. Her name tag read Wade. Lieutenant. Her eyes swept the room with the cold efficiency of someone conducting an inventory, landing on the Marine, then on Elena, then on the exposed tattoo that Elena was suddenly very aware she should have kept hidden. Wade's expression did not change, but something flickered behind her eyes, a calculation happening faster than Elena could track. Nobody leaves this room, Wade said. Her voice was quiet. That made it worse somehow, more dangerous than if she had shouted. She moved to the doorway and planted herself there like a wall made of regulations and classified orders. The older doctor, the one with the steel-gray hair, turned on Wade with the kind of fury that came from 3 decades of running an emergency room and not taking orders from anyone who was not holding a scalpel. Excuse me, Lieutenant, but this is my trauma bay and that man is bleeding out. Either help or get out of my way. Her name tag read Dr. Patricia Reeves, Chief of Trauma Surgery, and she looked ready to physically remove Wade if necessary. Wade did not move. That patient is part of an active military operation. Until I clear him, he is under my jurisdiction. She pulled out a phone, the kind that looked too thick to be normal, probably encrypted 6 ways from Sunday. I need this room sealed. No one in or out without my authorization. Elena felt her pulse hammering in her throat. She looked down at the Marine. His eyes were still on her, but the wildness had drained out of them, replaced by something sharper, more focused. He was trying to tell her something without words. His right hand, the one that had snapped the restraint like it was paper, moved slowly, deliberately. His fingers tapped against the gurney rail. 3 taps. Pause. 7 taps. Pause. Another pattern Elena recognized from another life. Morse code. 3-7. Sandstorm Alpha. The blood in Elena's veins turned to ice water. That code should not exist anymore. That operation had been buried, scrubbed from every record, erased from every file. She had been there the night it went wrong. She had watched half her unit die in a building that was supposed to be empty. She had carried the survivors through smoke and fire and darkness while someone kept changing the extraction point. She had made it out with 3 soldiers who should have been dead. This Marine had been one of them. Dr. Reeves moved toward the Marine with a syringe, something to knock him out so they could operate. Wade stepped forward, hand moving to her hip where Elena could see the outline of a sidearm under her jacket. Doctor, I need him conscious. He has information that cannot be lost. Information, Reeves spat the word like poison. He has a bullet fragmenting near his subclavian artery. In 5 minutes, he will have information and a funeral. She did not wait for permission. She brought the syringe toward the Marine's foreline. The Marine's hand shot up again, faster than someone bleeding out should be able to move. He caught Reeves's wrist, not hard enough to hurt, but firm enough to stop her cold. His voice came out rough, damaged by whatever had happened before he arrived, but clear enough that every word landed like a hammer. Not yet. He looked past Reeves, past Wade, straight at Elena. Sandstorm, he said. Alpha 7. Verify. Elena's mouth went dry. Everyone in the room was staring at her now. Wade's hand had moved closer to her weapon. Reeves looked confused and furious in equal measure. The other nurses had backed up slightly, sensing something happening that was beyond their training. The security guards were still picking themselves up off the floor, watching the Marine like he might explode again at any second. Elena knew what he was asking. Verification protocol. Call and response. If she answered wrong, he would assume she was enemy, assume this whole hospital was a trap, and he would fight until his heart stopped, or theirs did. If she answered right, she would be confirming things that could put her in a military prison for the rest of her life. Sandstorm Alpha 7 was classified above top secret. Speaking those words to anyone without clearance was treason. She opened her mouth to answer, and Wade's phone rang. The sound cut through the tension like a gunshot. Wade answered without taking her eyes off Elena. Her face went pale. She listened for 10 seconds that felt like 10 hours. Then she lowered the phone and looked at the Marine with an expression that Elena had seen before, the look soldiers got when they realized they were standing on a mine. The accident that brought you here, Wade said slowly, was not an accident. Someone tried to kill you. And they are coming to finish the job. The lights went out. All of them. The entire hospital dropped into darkness. Emergency generators kicked in after 3 seconds that lasted forever, bathing the trauma bay in dim red emergency lighting that made everyone look like they were drowning in blood. Somewhere down the hall, Elena heard screaming. The emergency lights painted everything in hell red. The screaming down the hall cut off mid-breath, replaced by something worse. Silence. The kind of silence that meant someone had been silenced. Elena's training kicked in before her fear could catch up. She grabbed the crash cart, yanked it sideways to block the door, metal wheels shrieking against tile. Not enough to stop anyone, but enough to buy seconds. In situations like this, seconds were the difference between breathing and bleeding out on the floor. Dr. Reeves grabbed Elena's shoulder. What are you doing? That cart costs $40,000. Elena ignored her. She was already moving to the Marine, checking his 4-line, his monitor leads, calculating how much time they had before he crashed from blood loss versus how much time they had before whoever was in that hallway found them. The math was not good either way. Wade had her weapon out now, no longer pretending this was a normal military liaison visit. She moved to the door, staying low, professional. Her entire demeanor had shifted from bureaucratic officer to something else, something that moved like Elena remembered moving in places where the rules were different, and survival was the only law that mattered. How many? Wade asked, not looking back, eyes fixed on the narrow window in the trauma bay door. Elena started unhooking the Marine from the machines that were keeping him monitored, but also keeping him trapped. He was already trying to sit up, his body responding to the threat, even as blood continued seeping through the hasty bandages someone had slapped over his wound. She put a hand on his chest, firm, the way she had learned to handle soldiers who were more afraid of being helpless than dying. Stay down. We need to move, Wade said. She was already at the door, checking the hallway. It was clear for now, but clear never lasted. More are coming. This was a kill team, and kill teams do not stop until the job is done, or they are all dead. Dr. Reeves crawled out from behind the overturned equipment, her face pale, her hands shaking. She looked at Elena like she was seeing her for the first time. Who are you people? Her voice cracked on the last word. Elena helped her up, gentle but fast. No time for long explanations. No time for the truth about who she had been before she became a nurse trying to leave the war behind. Right now we are the people keeping you alive. Stay close and stay quiet. The Marine moved toward the door, each step leaving a small red footprint on the white tile. He was running on pure adrenaline and stubbornness, the kind of combination that could keep a man moving long after his body should have quit. Wade grabbed his arm, trying to steady him. You should be dead right now. He smiled, and it was not a nice smile. It was the smile of someone who had died before and came back anyway. Been dead before. Did not take. They moved into the hallway. The emergency lighting turned everything into a nightmare maze of shadows and red glow. Elena could hear sounds echoing from other parts of the hospital. Footsteps. Shouts. The metallic click of weapons being readied. How many shooters were in the building? How many patients were about to become collateral damage? How many nurses and doctors and janitors and security guards were going to die tonight because of whatever classified mess the Marine had dragged into her hospital? Wade led them toward the service stairs, the route most people forgot existed. Elena supported the Marine from one side, feeling his weight increasing with every step as his body started to realize how badly damaged it was. Dr. Reeves followed, still in shock, still trying to process what her nice, safe hospital had become. They made it 15 feet before the elevator at the end of the hall opened. 4 more men stepped out, not dressed as paramedics this time, not pretending to be anything except what they were. Killers. Wade raised her weapon. The Marine raised his. Elena had nothing but her hands and her training and the absolute certainty that she was not going to let anyone else die tonight. Not on her watch. Not in her hospital. The lead man smiled. Nowhere left to run. The Marine's response was immediate. He grabbed Elena and Reeves, threw them through the nearest door into what turned out to be a patient room, and opened fire. The patient room was occupied. An elderly man hooked to monitors, his eyes wide with terror as Elena, Reeves, and the Marine crashed through his doorway, followed by the sound of gunfire that echoed like thunder in a concrete canyon. Elena hit the floor rolling, muscle memory taking over, her body moving in patterns she had trained into her bones years ago. The old man opened his mouth to scream, and Elena was already there, hand gentle over his mouth, voice calm despite the chaos. "Stay quiet. Stay low. You are going to be fine." The Marine slammed the door shut and shoved a chair under the handle. It would not hold long. Nothing would hold long against trained killers who had already murdered their way into a hospital. Blood ran down his side in steady streams, soaking through his pants, dripping onto the clean white floor. He was pale now, shock setting in, adrenaline starting to fail. Wade was already at the window, trying to pry it open, cursing when she realized it had been sealed shut. Hospital policy. Fire safety. The same rules designed to protect people were about to trap them. Dr. Reeves was breathing too fast, hyperventilating, her hands clutching at her coat like she could hold on to something normal if she just gripped hard enough. Elena grabbed her face, forced eye contact. "Doctor, I need you here. I need you thinking. That man is going to bleed out in the next 5 minutes if we do not do something." Reeves blinked, her training fighting through the panic. "We need a surgical suite. We need equipment. We need to work with what we have." Elena cut her off. She was already pulling open drawers, grabbing whatever supplies this random patient room contained. Gauze, tape, a bottle of saline solution, a suture kit that was meant for minor lacerations, not battlefield surgery. It would have to be enough. The door shuddered as something heavy hit it from the other side. Once, twice. The chair legs scraped against the floor, holding but barely. Wade fired 3 shots through the door, spacing them strategically, buying seconds they did not have. Her magazine clicked empty. She dropped it, slammed in a fresh one with the smooth efficiency of someone who had done this 1,000 times. "How many rounds do you have left?" Elena asked. "Enough," Wade said. It was not an answer. It was a prayer. The Marine slid down the wall, his legs giving out, his weapon still up, but wavering. Elena was at his side instantly, her hands moving over his wound, assessing damage she could feel but not see in the dim emergency lighting. The bullet had hit something important, something that was bleeding internally, filling spaces that should have been empty. She looked at Reeves. "I need you to hold pressure here. Right here. Do not let go." Reeves moved on autopilot, her hands finding the wound, pressing down while the Marine grunted in pain but did not cry out. Elena grabbed the suture kit, ripped it open with her teeth. This was going to be rough. This was going to be medieval. This was going to hurt worse than getting shot in the first place. She looked into the Marine's eyes. "I need to go in after that bullet. I need to do it now. No anesthesia. No sterile field. Just pain." He nodded once. His hand found hers, squeezed once. "Do it." The door exploded inward. The chair went flying. 2 shooters came through fast and professional, weapons up, scanning for targets. Wade dropped the first one with 2 shots center mass. The second one got a round off that punched through the wall 6 inches from Elena's head, showering her with drywall dust. The Marine, half dead and bleeding out, raised his weapon with a hand that should not have been able to lift anything and put a bullet through the shooter's throat. The man went down choking, his weapon clattering away. Elena did not stop working. Her fingers were inside the Marine's chest now, feeling for the bullet fragment that was tearing him apart from the inside. She found it, a piece of metal lodged against bone, and she pulled. The Marine's entire body went rigid. His free hand gripped the bed rail hard enough that the metal creaked. Elena pulled harder, feeling tissue tear, feeling warm blood pour over her fingers. The fragment came free, jagged and cruel, and she threw it across the room like it was poison. Reeves was already there with gauze, packing the wound, her hands steady now, her training overriding everything else. Wade was at the door again, checking the hallway, her weapon tracking left and right. "Clear," she said. "For now." Elena worked fast, suturing what she could reach, knowing it was temporary, knowing he needed real surgery or he would die anyway, but buying time because time was all they had. The Marine's eyes were closing. She slapped his face, not hard, but enough to bring him back. "Stay with me. You do not get to die after all that. His eyes opened, focused on her. Sandstorm, he whispered. Alpha 7, she answered. The verification complete. The recognition absolute. Wade's phone buzzed. She checked it, her face going from grim to something else. Something like hope. Reinforcements are 2 minutes out. Real military. Not the compromised unit that sent these killers. We just have to hold. 2 minutes might as well have been 2 hours. Elena could hear more footsteps in the hallway. More shooters regrouping. They had come to finish a job, and they were not leaving until it was done. She looked around the room. One wounded Marine. One doctor who had never fired a gun. One lieutenant with limited ammunition. One nurse who had sworn an oath to save lives, not take them. And one terrified old man who was about to witness either a miracle or a massacre. Elena stood up. She grabbed a metal 4-pole, tested its weight, found it acceptable. Reeves stared at her. What are you doing? Buying 2 minutes, Elena said. The shooters came through the door in a rush, 3 of them this time, coordinated and lethal. Elena swung the 4-pole like a bat, caught the first one across the face, felt bone crack. Wade shot the second one before he could aim. The third one got his weapon up, finger on the trigger, aimed at Elena's chest. The Marine, running on nothing but willpower and spite, threw his empty weapon like a tomahawk. It hit the shooter in the temple, dropping him instantly. Silence fell. Real silence this time. Elena stood in the center of the room, breathing hard, covered in blood that was not hers, holding in 4-pole like a sword. The old man in the bed was crying quietly, hands over his face. Dr. Reeves sat against the wall, staring at nothing. Wade was checking bodies, making sure they stayed down. The Marine looked at Elena with something like respect, something like recognition. You fight like one of us, he said. I am one of you, Elena answered. I just use different weapons now. The sound of boots in the hallway. Heavy. Fast. Military cadence. Wade looked through the door, then lowered her weapon. They are ours. Soldiers poured into the hallway, real ones this time, securing the floor, checking rooms, calling for medical. Elena sank down next to the Marine, exhausted, her hands shaking now that the adrenaline was fading. Paramedics arrived, real ones, with real equipment. They loaded the Marine onto a stretcher, started fluids, prepped him for transport to surgery. He grabbed Elena's hand as they wheeled him past. What is your name? He asked. Elena Torres, she said. He smiled, tired but genuine. Thank you, Torres, for breaking the rules. She watched them take him away. Dr. Reeves stood next to her, still processing, still trying to understand what her night shift nurse had just done. You saved his life, Reeves said quietly. You broke every protocol, every regulation, every rule I have ever taught. And you saved his life. Elena looked at her hands, at the blood drying under her fingernails. Some rules are worth breaking. 3 days later, Elena stood in the hospital administrator's office, expecting to be fired, expecting to lose her license, expecting consequences. Instead, she found Dr. Reeves waiting with a folder. Inside was a proposal for a new program, a trauma protocol for treating combat veterans with PTSD and acute injuries. The Torres Protocol, they were calling it. Integration of combat medicine techniques into civilian emergency care. And they wanted Elena to head it. You cannot be serious, Elena said. Reeves smiled, the first real smile Elena had seen from her. You fought like a warrior to save a life. That is exactly what we need. Someone who knows both worlds. Someone who can teach us to be better. Elena took the folder, her hands steady now. She thought about the Marine, about Sandstorm Alpha 7, about all the ghosts she had been running from for 3 years. Maybe it was time to stop running. Maybe it was time to turn those ghosts into something useful. She opened the folder and started reading. The war had found her again. But this time, she was ready. If this story just proved that heroes do not always wear capes, sometimes they wear scrubs and break every rule to save a life, then you need to hit that subscribe button right now, because we are just getting started on stories about the warriors you walk past every single day without even knowing it.